Well, hello there. It's Dr. Jim Collins. Thank you for spending some time with me. I have a sad topic, but a serious topic, and it's one of those I don't necessarily enjoy talking about, but I think we have to raise awareness. We have to really help as many veterans as we can with their depression, with their mood disorders, with their homelessness, with their poverty. And we have to do our very, very best to help prevent suicide. So, wrote a good article. It's online. You could find it, print it, share it with your colleagues. If you'd like some more information, email me, jim@collinslearning.com. I think this is very, very important to share with as many people as you possibly can. I would love to see this video reach tens of thousands of people. So let me give you a quick introduction. Veterans, especially those who experienced combat and were deployed overseas, are definitely at an elevated risk of mental health conditions and, unfortunately, the possibility of suicidal behavior. It starts with suicidal thinking, and then some people advance to actually taking their lives. Research has found that those who have served since the 9/11 attacks are especially vulnerable. I didn't know that until I did the research. 1 in 5 veterans experience mental health issues, including post-traumatic stress disorder, PTSD for short, major depression, and the third most commonly experienced problem is alcohol use disorder. And that's a newer diagnosis in the DSM-5 if you want to check that out. So it's a pretty bleak picture. I hate to say it. I don't want to say it, but if left untreated, any or all of these conditions, depression, PTSD, alcohol use disorder, can lead to chronic and damaging consequences in the person's physical life, their social, their mental, their emotional, and even their neurological and spiritual health can be affected. Impairment may occur in relationships and careers, parenting, occupations, and overall quality of life for the vet, his or her family, their circle of friends. Everything can take a nosedive. It's a terrible situation. And of course, the worst case scenario is the tragic loss of life due to suicide. So I want to read some very important stats for you. Trying to give you the best and the most recent statistics about this that I can. Current U.S. Census reports indicate around 18 million veterans, and over 2 million active duty and reserve service members are active right now. Beginning with the 9/11 attacks, 2.8 million active duty American military personnel were deployed to Iraq, Afghanistan, and beyond, leading to increased numbers of combat vets in the population. Over 6% of the United States population have served or are serving in the military. I didn't know that either. 6% of everyone in this country. Suicide rates are higher among veterans versus non-veterans, and some experts predict that suicide rates may actually double for veterans. Here are some common health conditions that our vets experience. Like I mentioned earlier, PTSD, major depression, traumatic brain injury, TBI is a major issue, alcohol dependence, poor adjustment to civilian life coming back from the war zones, stress and strains with interpersonal relationships, sudden outbursts of anger and frustration, anxiety, and insomnia. That's enough. That's a long list. Beyond these conditions, many veterans deal with other serious issues. Some have been evicted from their homes. They're living on the streets. They're homeless. Some are unemployed for various reasons, including addiction or physical handicaps. Other veterans may live in perpetual feelings of guilt and shame based on what they experienced in the military. Okay? So what I'm really trying to stress is an awareness for signs and symptoms, reaching out, and the importance of intervention. Intervention. So, if predictive risks are accurately identified, clients at risk can benefit from suicide intervention approaches. When working with veterans, it's important for mental health and other healthcare professionals to assess for suicidal ideation, intention, planning, as well as a history of any suicidal thoughts or behaviors in the past. There's some very delicate topics to talk about. And you should be a trained healthcare professional to do this, or a mental health, behavioral health professional to do this. But if you're a friend, a loved one, or a family member, you might be able to gently approach some of these topics, but do so with caution and care. Ask about their current mood. How are you feeling? Have you been depressed lately? Have you had some bad thoughts in your head? Are there thoughts in your head that you can't stop thinking about? Have you left a suicide note before? Are you thinking about leaving a suicide note? Do you ever talk about the intent to die? What are your support systems like? Do you have good support from your family, your significant other, your kids? If they're, adults, they're going to be adults. From your community, from peers, colleagues, your church, from the military itself. And what kind of current problems are you having? There's so many questions to ask, including how's your health right now? Do you feel okay? Do you feel good? Do you feel bad? Do you feel healthy? Do you feel stable? Are you experiencing any health problems right now? And if you do have health issues, how do they affect you? That's important to know. And how does the current state of your health make you feel? So if the veteran has experienced a recent death of a loved one, it might be helpful to ask questions like, who among your family and friends have you lost? And how do you feel? When did this happen? And how has this affected you? Do you see how delicate? This is a delicate thing. So here are some evidence-based practices. I got into the research and I looked at how can we help them? As a family member, as a friend, we can guide them gently to seek professional help. What type of help would they get? These are types of therapies that I've studied for years and I know can be very effective. Prolonged exposure therapy, cognitive processing therapy, acceptance and commitment therapy. One of my favorites, mindfulness-based therapies. Eye movement desensitization and reprocessing. Sometimes brief eclectic psychotherapy. It's one of the many psychotherapies out there. But my final thought is this. The taking of anyone's life is tragic. Losing one vet is losing one vet too many. They've done a wonderful and noble thing for our country. Not all of us are fit, capable, able, or even want to put on the uniform, stay here or go overseas, whatever it is, or to serve our nation. And when these men and women come back hurting, emotionally, psychologically, physically, I think as a kind and warm people, we should reach out, help them as much as we can. But our skills and knowledge are limited. Guiding them to the appropriate care is probably the best thing that you could do. Okay, I'm Dr. Jim. And I know I was kind of heavy, but it's a topic that we need to address and we cannot forget. Never forget our vets. Keep coming back for more. information, education, and to find out what I have on my mind. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.